So the options that we have when we're restoring anterior teeth that have cavities, we can use composite or plastic resin, or we can use a pre-veneered stainless steel crown. To me, those are the only two options. And in my experience, and what studies have shown me, and I taught for many years, so I was the one who was teaching the students and the graduate students and the residents the literature. And my experience, my understanding of the literature is that the composite restorations don't hold up for the long term. We can do a beautiful resin restoration on a tooth. We can do a beautiful composite restoration, what's called a strip crown. That's one option, but they don't hold up for the long term. They don't. Sometimes we're restoring large cavities on 2-year-old kids. So one option is the plastic or composite restoration, and one is the pre-veneered stainless steel crown. And what my experience has shown me is that the plastic or the composite restorations, or the strip crowns as they're called, they don't last for the long term. Studies have shown that teeth flex, and if we're talking teeth flex, and composite is notoriously poor in shear and tensile strength under strains, teeth flex, and the composite just doesn't hold up over time. And so when we're restoring these large carious lesions in these kids who are 2 or 3 years of age, we're asking a plastic restoration to last for 4 or 5 years, and that's asking too much of a plastic composite resin. So what's a much better option is to do a pre-veneered stainless steel crown. And the reason why the pre-veneered stainless steel crown is better, because they hold up well, they look good, and you don't have the problems of the plastic chipping and having to redo that tooth again. The worst thing that you can do for a child is restore the tooth and then ask that same child a year later or 2 years later to go back in and restore that same tooth. So we want something that's durable, that once we treat the tooth, we never have to treat the tooth again, and something that'll last and look good for the lifetime of the tooth. And so the crown that I use is the NuSmile Crown. And I've probably used every crown that's available on the market in my teaching and in my practice, having worked for a number of people who use what they use. And so I think I've used every crown that's on the market. And I've come back to using NuSmile. I use NuSmile for over 15 years now, and I'm very pleased with the results because they look good and they hold up well for the long term.